Joe, are we good to go? Almost?
Do I need to hit the button, or we're good? Okay.
All right, good afternoon, everyone. The time is 4:09. Welcome to the Health and Mental Health Committee agenda meeting for Tuesday, July 18, 2023. If you all would please turn off your devices and please rise to join in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Doreen, could you do a roll call, please?
Amo, Anagnostakis.
Present.
Ellers, Luhan, Sutherland, Tortel, Tui.
Here.
Present, one absent.
Thank you, Doreen. First up, we have Commissioner of Social Services and Mental Health, Darcy Miller. If you would come on up and join us at the podium. A little bit better. We're trying.
Okay, can you hear me? Good.
Yes.
So first of all, I just thank you for having me here this afternoon, and I want to thank Lacey Trimble, our Deputy Commissioner, and all of the social workers who have been on the ground in Highland Falls supporting the members of the community and the workers who are there. So really appreciate their
Thank you all. And, you guys know what it is, the team effort. I know that. And I know it sounds like everybody kind of came out from various departments up there to help out. So.
Yes, and our Orange County Crisis Call Center, right? What a good decision. Mental Health
Yeah.
Association's been doing a fabulous job.
Exactly. Thank you.
Sir, I want to thank you, and please, on my behalf, thank your team for everything they've done for every member of our community. I've been on the phone with your staff on the weekends, at night, early in the morning, texting at, 4 or 5 o'clock in the morning, and everybody has been so responsive and so compassionate and caring, and they have gone above and beyond 110% in what they do for the residents, for our community.
And you also. So thank you. You send the needs our way. We appreciate that.
Welcome, thank you.
So I just want to talk about the opioid settlement funds. We did receive our proposals back from our request for application. We are reviewing them and scoring them now. I'm still in a blackout period, so I can't say more than that, but I will fill you in on some of the details once we move this forward. I just asked, and I appreciate Doreen for sending to you all. I wanted to send you the cannabis fact sheet that came out from the New York State Office of Cannabis Management. Just gives you some details. You may want to share it with your communities. It gives some good direction, advice, and some support numbers if someone doesn't start low and go slow in the use of recreational marijuana, cannabis for those who are 21 and older. And
Darcy, could you send that in digital form to Doreen that we can send out to all legislators for those that have the community channels so we can pop it?
yeah, so well, the way I sent it to you, I don't know if it's social media ready, but it is electronic,
Um,
and how you received it.
Okay.
Check it out, see if you can. If not, then I'll send it in a different format. Just let
Okay.
me know. Send
Yeah,
me
if
a
you want to
quick
send it, then I'll get right back to you.
Okay, perfect. No problem. Absolutely. I appreciate that. That's the purpose of it, sending the messages out. I appreciate that. Just to let you know that the Children's Youth Act team will start taking clients in mid-August. We did talk about that here. That is an 8.5 FTE team that will be responding to the needs of 48 youth in our community with serious emotional, mental, and behavioral challenges. And we appreciate RSS and Access Supports for Living for their collaboration and the state for the funding of that team. Lastly, our comprehensive continuous integrated system of care, Welcome Orange, which I'm probably dating myself, but I think it was 10 years ago now we began that initiative, which is, a joint vision and mission created by ourselves and multiple county departments and stakeholders across the community in multiple disciplines. And we not only have it here, but extended it throughout the 7 counties in our region. We were asked together to present to the New York State Opioid Settlement Fund Committee. Very exciting opportunity. We really feel strongly that the state needs to have some foundational concepts that they use as they're making decisions about supporting those who have great need in our community. And one of the greatest pieces of this work is the co-occurring acknowledgement. So people with a substance use disorder at high percentages have mental health challenges, and mental health challenges have high comorbidity to substance use. And so this great work and the presentation to the state committee hopefully will take it beyond our 7-county region. And that's all I have for you today.
All right, great. Thank you, Darcy.
Sure.
Do any committee members have any comments or questions? Nope, not hearing any. Darcy, Commissioner Darcy, thank you very much.
Have a good afternoon.
Okay, you too. All right, next up, item 2, we have Dr. Alicia Pointer, the Commissioner of the Health Department. Come on up, Doctor. Welcome.
Thank you. Good afternoon. Darcy's a little taller than I am.
First up, we have item 2A. It's a request supplemental appropriation of year 2 of 5 funds from the New York State Department of Health for the Perinatal and Infant Community Health Collaborative Program for the period of 7/1/2023 through 6/30/2024. That's in the amount of $440,000. It's legislative request number 184. May I get a motion?
Motion.
Sutherland and Tortel. Okay, Doctor, the floor is yours.
This is, we call it PITCH. It's our home visiting program. This is for pregnant and parenting moms and their infants and children. Most of our costs goes to staff, but we also provide a lot of services for these families, including car seats and car seat installation. We sometimes provide resources like foods and diapers. We do a lot of safety projects, so baby gates, other safety kits, pack and plays for safe sleep. We have a new line item that's mental health services. This was based on a study of our current families and some of our partners for what these families really need. So we're working to determine what kind of mental health help we can get these new parents.
Okay, I just have one question. I know a few years ago it was in the news a lot about the dressers that fall over.
Mhm.
Is that included in this program at all?
It is. So when we're in the homes visiting, if we notice safety issues like that, we'll inform the families and we'll give them supplies. So similarly to if we see that they don't have a safe place to sleep, we'll give them a pack and play. We can give them the furniture straps and things like that. We also have a Healthy Neighborhoods program separate from Pitch that does something similar.
Okay, thank you. That sounds great. Legislator Lujan?
Thank you, Mr. Chairman. Thank you, Commissioner. In regards to the mental health for women, is that, for example, for postpartum depression, or is it a campaign of some sort for parents who might be, or for individuals who might be seeking mental health support because of postpartum depression?
It's still definitely in the work. So postpartum is one mood issue that parents talk to us about, general stress, anxiety. We don't have a specific plan for how to provide these mental health services at this time. This is supposed to be a transition for people who can't get into mental health services now. So we've talked about options like a texting program or group programs, maybe even making videos or having classes that families can do virtually. So it's still up in the air, but it's a huge need that families have expressed to us. And we know that this is a need countywide, and a lot of these new moms can't get into mental health care. And we know that for them and their kids, the sooner that they get in, the better.
Have we create any posters or any social media links or anything for people to be able to link up? Or is there any plans to make any like Zoom groups for individuals who might be seeking that?
So right now we do some social media posts about postpartum depression, about programs like Text for Babies is one that gives parents mental health tips, but then also tips for their own babies. One thing that we have already implemented is a walking group for these moms, and we provide strollers. And one way to kind of help them to get those social interactions, feel like they're getting exercise and getting out of the house, but we also incorporate mental health into those walking groups. We found that a lot of parents are more likely to seek services for their children than they are for themselves. So as much as we can incorporate those mental health messages into other things that they're looking for, the better. So that's where our goals are right now.
Okay, any other questions or comments? Not hearing any, I'll call the question. All in favor? Aye. Any opposed? None seeing, motion carries. Okay, doctor, if you want to go into your update, that'd be great.
Sure. So starting with infectious disease, last week we were informed that we had our first West Nile positive mosquito pool. We do test 9 sites throughout the county, so this doesn't mean a person who had West Nile, but a mosquito that tested positive for West Nile. This is an early positive compared to last year. We are meeting on Thursday of this week with our testing partners and our larvicide partners. So this program also includes applying larvicide to catch basins throughout the county to kill the larva and get rid of the mosquitoes. We're also going to talk about how the recent flooding will impact those efforts, because we certainly have water in places that we haven't always had water in the past, which is a concern.
Okay, thank you.
Speaking of which, I wanted to thank our staff and our Medical Reserve Corps volunteers who really stepped up when we needed them dealing with the recent flooding. As you have already talked about, it was a group effort. And when we needed them, our volunteers really stepped up and offered their time, which was a huge help. So thank you to them. I'm just coming from our Public Health Emergency Law Symposium, which took place yesterday and today. Yesterday was more of an educational session, and today was a tabletop. It was jointly hosted by us, the Department of Health, and the CDC. It was great to have the CDC here to talk about their role in these situations, and it's something we'd like to repeat in the future.
Well, it was a pleasure to join you over there for today's session, and
It was wonderful to have you there. Thank you for
sorry I
coming.
had to leave a little early. We had some meetings here.
I had to leave early too, and I was told that they killed me off after I left.
Oh.
So in our scenario, our tabletop.
Good, good, terrific.
Yep. And I also wanted to highlight our community health outreach team, a few exciting things going on with them. So summer is a really big time of year for them. I listed a few summer events that they're involved in over the next couple months, but this is their chance to get out in the community, talk about what we offer, not just with community health outreach, but with the health department in general. We're trying as much as possible to go where people already are. And so they've been doing a lot of that this summer. Part of that is our farmers markets, which have been very successful. They're going great so far. We have one in Newburgh on Tuesdays and one in Port Jervis on Saturdays. They accept Fresh Connect, which is the veterans coupons, senior vouchers, SNAP, WIC. And we have a few exciting collaborations. So one is we had a tomato plant and seed giveaway. We already did it in Port Jervis. It was a really big success. We do that with Cornell Cooperative Extension and their Master Gardeners program. And then we have an upcoming one in Newburgh, July 25th. And we also deliver farm boxes to community organizations. So we buy these farm boxes from farmers at the end of the farmers market, and then we give it to community organizations who give it out to the people that they serve. Again, the farmers markets also give us a way to really reach our communities where they already are and provide this service to them while we're telling them about what other things we can offer them. And we had our 5-year breastfeeding grant. This was a new grant, $987,000. That started on July 1st. So we're really excited about that and about encouraging breastfeeding and making it easier for families, businesses, and some of our healthcare providers to really encourage breastfeeding locally.
That's great. And then you have some upcoming events, or how's things going with the mobile unit, the Department of Health mobile unit? Is that getting out and about a lot of these different events, or?
It is. It's been a really big hit. It's actually out being serviced now. It went out last week and they said they would have it for 2 weeks. It's just to put on stabilizers, so no issues. But it is. People have requested it. A lot of our community partners. I think it's going to the Hudson Valley Fiesta Latina. We weren't able to have it at the Desmond Center because it's being serviced, but it may be at these national nights out. So we have, I know Cornell Cooperative Extension has a country fair
Country fair at the
coming
end of the
up.
month.
Yep.
Yep.
So lots of exciting places. And then we're hoping to have it more regularly in Port Jervis, for example. So that would be, you know, not for one specific event, but having a more regular presence there. We just updated our website and we're starting to put on our website a calendar of where our Health Grows Here unit is going to be at any given time. So people can easily look there, find out where it's going to be and what services are going to be offered. So we've just started uploading those in the past week.
Good, very, very good. Legislator Lujan, you had a question or comment?
Yes, Mr. Chairman, I just want to see if the commissioner could you please talk a little bit more about the breastfeeding grant and kind of like what it's going to be used for or what it's being used for? And I love to hear that, you know, we're trying to make that more of a, like, more acceptable, more, I mean, like, there's still, it's crazy to think that we still do not have so many businesses that are not, you know, adapted to that. But could you maybe just go into a little bit more depth so that, you know, we could be able to also share that information out there?
Sure.
Thank you.
So we're partnering with some of our healthcare facilities, so hospitals and healthcare providers, or FQHCs. We're also partnering with Mid-Hudson Chocolate Milk to make sure that we reach some of our minority communities. For the healthcare facilities, we're trying to offer training. We're offering some peer counselors and also offering supplies that they need to make breastfeeding easier in their own facilities. We're doing something similar with workplaces. So for example, if they want a room where people can go and pump during the day, you know, making sure that we're offering whatever they need to do that, whether it's furniture or a mini fridge, you know, things like that. Peer counselor separate for people who, you know, are nursing and really just need some of that extra support. Maybe they don't necessarily need to see a lactation counselor in the hospital, but just need that extra encouragement for those little things that come up. So those are some of the biggest things we're doing is making sure that workplaces have more accessible areas to pump and nurse and also are aware of what the laws are. And if they need help developing policies, helping them with that, helping the healthcare facilities, both support families who are having issues, who come to them with questions and concerns, but also for their own staff and for people who just happen to be in those healthcare facilities, making it easier for them to pump and nurse. And then this collaboration to make sure that we're really reaching the right communities where our, you know, efforts at encouraging breastfeeding are going to have the biggest impact. A lot of it is training, you know, a lot of the funding is going toward training, but also some of these supplies.
Okay, great. Any other comments or questions? Not hearing any. Thank you, Commissioner. And
Thank you. Have a good
report.
afternoon.
You too. Oh, Legislator Tortel.
Commissioner, I wanted to thank you and your staff for being on the ground, especially with our water testing and our well testing and the disaster that's happening. I know that we have a report over the weekend that a significant number of the wells within the town outside the village that don't have municipal water have received contamination, and her staff has been on top of it and notifying residents and working with us to,
I think that was E. coli.
well,
Yeah, I can speak to that briefly. Thank you. And you've been a huge help too, getting us connected with the right people. So we went out last week to do testing of private well water. So the public water systems have already been sampled and have been cleared. This is private well water for people who are affected by flooding. And the majority of our samples returned positive for coliform and or E. coli, which means that people on private well water affected by flooding are still needing to boil their water for cooking, drinking, and brushing their teeth. The next steps are that residents will have to disinfect their wells and then retest after disinfection. We are going back out tomorrow, both to do some more sampling, but more to talk to people about this disinfection process and provide some education. And then we're also trying to work with some of the relief organizations to see if they can help residents with disinfecting, because while it's not an especially complicated process, there are going to be residents who need assistance with disinfection, either need supplies or need help doing the disinfection themselves. So we're hoping that we can get some support there. But
yeah, where you have the wells, we have a population of older communities, and also some of the wells are very hard to get to down below, you know, the frost level. And so, yeah.
of course, it's going to be, we understand it's going to be a problem for people having to do this on their own, especially on top of everything else that they have to do. So we're hoping that we can get them some extra help there too.
Great, thank you. Thank you for all your help. I really appreciate it. And let
you.
your staff know. And I bothered Lisa over the weekend, and we had her going on a very lengthy conversation, and she helped us sort out some places where it was municipal versus well, and so on and so forth.
I'm
So-
lucky to have a great team.
Yeah, thank you.
Thank you, Lindsay.
Thank you, Mr. Commissioner.
Thank you, Commissioner.
Thank you.
Take care. All right, next up, we have Donna Strecker, Director of Finance from the Valley View Center for the monthly financials and a monthly update.
Good afternoon.
Good afternoon, Donna. Thank you.
Lawrence is on vacation. He sends his regards. He's with his family at the beach. The results that we're reviewing today are, as of 7/10, reconciled to the general ledger. Represents our performance for the first 6 months of the year. There hasn't been any change in the IGT funding since the last publication. Public nursing home revenues are coming in at 18,062,000. We are still being challenged by the lack of resources in being able to recruit licensed caregivers, particularly RNs and LPNs. We do have contracts with staffing agencies right now. We have 5 of them, and we are actively pursuing that as well. On the personal service side, we've expensed 11.6 million through June. Equipment, we've purchased 48,855. On the contractual side, we have 4.5 million earmarked for expenditure, and we've already expended 6.6 million. The indirect cost doesn't post until year end. Employee benefits are coming in just under 9 million, and we have a small amount of serial bond debt at the 34,379.
Okay, any questions, comments? Okay,
Okay, and if you turn to the second page, you should see, it should look like this with the graphs. You can see historical occupancy. So for June, our occupancy was 64.06, and the average for the first 6 months of 2023 coming in at the 63.63.
okay.
And the last report, financial report that you have is analysis of payer source and days. If you look over in June, our Medicaid utilization was 72.43, a small amount of Medicaid HMO at the 1.69, and our Medicare at 14.72.
Okay, the private seems to be going up a little bit, trending up.
Mhm. Yes.
All right. Committee members, any questions?
I
Comments?
also have a report from Mr. Ledoux.
Yes. Do you need mine, or you got one? The update?
Pardon? Yeah, I have his update.
Okay.
Okay. Valley View census as of today is 63.89. We still have 3 units closed due to the issues surrounding recruitment. We are admitting short-term residents at this time. Valley View's CHA census is 12. We've had 6 new admits, 7 discharges, and conducted 180 therapy treatment sessions in the community.
That's remarkable
Yeah,
with that, with the staff that you have there to have 180 in the
Thank
month
you.
of June.
thank you
Thank
very
you.
much. It's definitely a bright spot in our operations. We have 1 positive COVID resident and 1 staff member. We're waiting approval from the New York State Department of Health for the plan of correction that Lawrence submitted, both for the CHA and the nursing home. The DOH is now enforcing the nursing home minimum staffing requirements, starting with the second quarter of 2022. An average of 3.5 hours of care per patient resident day is required. 1.1 of those hours must be provided by an RN or LPN, and 2.2 hours by CNAs, and the remaining 0.02 can be a combination of RNs, LPNs, and CNAs. There will be penalties and fines up to $200 a day for noncompliance. Fortunately, I'm happy to report we are in compliance for the 3 quarters of 2022, and I will be moving into the analytics for assessing our compliance for 2023. Even though we were in compliance for 2022, during the analysis, I noticed that 29 days in each quarter, we did not reach the minimum staffing for our RNs and LPNs. So as we move into the 2023 analytics, I will be interested to see the outcome and the hours there because we did have some changes in the RN staffing. So we will follow that and give an update in the next meeting. A New York State labor law took effect on January 28th that increased penalties and imposed reporting requirements in relations to mandatory nursing overtime. Under the law, including prior to recent amendments, healthcare employees are prohibited from requiring nurses, this is specific to RNs and LPNs, to work beyond their regular scheduled hours except for under the conditions outlined below. A healthcare disaster that increases the need for healthcare personnel, a federal, state, or county declaration of an emergency, an unforeseen emergency and is necessary to provide safe patient care that could not be prudently planned for by the employer and does not regularly occur, an ongoing medical or surgical procedure in which the nurse is actively engaged and who continues presence is needed to ensure the health and safety of the patients. The law does not prohibit nurses from working voluntary overtime. It's a shame that New York has prioritized penalizing nursing homes and other healthcare systems during a national healthcare shortage over providing incentives and programs and policies that will enhance and encourage and improve the healthcare system and the healthcare staffing. These continue to be very challenging times for Valley View. We have passed the end of the public health care emergency. We are still struggling with many challenges operationally. By closing these units, I have to look back, but I believe in 2022 we had already closed one unit. These are the things that are helping us stay in compliance with the staffing mandates. So as we move into the next quarter, growing the staff, particularly RNs and LPNs, will become an important component in growing our revenue and achieving stability. Thank you for your support.
Thank you.
You're welcome.
Yes, Legislator Anagnostakis.
Thank you, Mr. Chairman. Thank you, Donna, for the report.
You're welcome.
On your last statement about going forward, obviously growing the staff is critical, but we've not been able to do that so far, correct? I mean, if I remember somewhere in here, I saw that we went down by like 30 on the staff last year versus the year before. So I understand it's critical to do that next year. You're going to try, but we've not been able to do that so far, correct?
No, I don't mean for next year. I mean, you know, in the upcoming year, 2023. That's what I meant to say.
In the current year.
Pardon?
In the current year.
Current year, yeah, in the next 6 months. You know, in the past 6 months, we didn't have as many staffing contracts as we do right now. I think in the last meeting, Lawrence reported on the number of applications we've had and what the retention was on that. Slowly, we're bringing in RNs and LPNs, but it's a very slow recruitment process. And when you have staffing that comes from staffing agencies, they're not as committed to a regular 40-hour work week and not as committed to giving us 40 hours. So lots of obstacles there.
Sure, I understand that, and I know that you guys are trying very hard, and I appreciate that.
We are.
You say you've brought people in, so can you tell me over the last 60 days, what's the net increase in our staff level on those positions?
Not without looking at a report.
Has it gone up?
Yes, I would say in the RNs and LPNs and per diems, we have recruited a few.
How far?
Mostly RNs, but I cannot give you the exact number without looking at the analytics.
Okay, so the next question, you're not going to be able to give me an exact answer either, but how far away are we from the number that we need to have to potentially open up a unit?
We're not close to that at this point in time.
Do we project that there's a possibility by the end of this year, you're saying you're going to try to increase again these staffing levels, that we would get to the point where we can have one additional unit open up?
We are incredibly hopeful. I think we need we would need a minimum of 9 CNAs to open up that unit, to open up another 30-bed unit. So we need 9 CNAs.
9 additional CNAs.
RN and LPNs. Well, we do have, because we also have issues with absenteeism. So all of these factors impact the staffing. So, yeah, we would need to recruit about 13 people at full capacity. At full capacity. You can see based on these reports that we are growing our short-term rehab. You can see that percentage continues to go up. So our goal is definitely to open up another unit. It will depend on staffing.
Of course. And finally, do you find yourself that we're spinning our wheels? Maybe we're bringing these people in, we're hoping to increase it to a level where we can open up another unit, but are we just bringing enough in to meet the minimum requirements that are imposed on us now?
Well, we run overtime every day. We're understaffed every day. So the way that we meet the PARs in nursing, each unit that we have has a set PAR, and we run overtime every day. And the result of that overtime is due to absenteeism, people having vacations, and now also a workforce shortage.
Okay, thank you. I said last one, but I got one final last one, I promise. How are we doing with the plan that was presented to us a couple of months now by Langdon Chapman that we voted to put in place for incentive on performance of showing up? And how are we doing with that?
We are going to discontinue the program. We met with and partnered with HR. I've been doing a lot of behind the scenes analytics. And what the analytics showed when I looked back and looked at 2022 versus 2023, attendance wasn't improving. And, you know, we are very grateful because there is a percentage of population that comes to work every day. And we didn't see any difference, and we weren't able to reduce the overtime, which was the goal. 2 goals: reduce absenteeism and reduce overtime. We didn't achieve that.
So we didn't achieve that, and the people were not getting additional compensation that were always showing up every day. So the program seemed to be 3
Correct.
strikes across the board, and you decided to stop it.
Pretty much mostly the people that came to work every day were receiving the incentive.
Oh, I see. Okay.
Right.
Okay. Thank you very much for all your work.
22 to 2023.
Thank you.
Thank you.
Donna, that's, I'm glad that you find a little bit of sunshine in there, that you are getting some nurses and CNAs, and just appreciate all your efforts and Lawrence's efforts to try to slowly turn the ship around as far as that goes. And I know you're doing everything every day, and you get creative, and thank goodness for the type of people that you have that show up every day. And I know you and Lawrence are 2 of them right there.
Well, it's really a collaboration of effort. You know, the team at Valley View, you know, we have to take a look back to realize how far we've come. Because working in this environment, sometimes we get caught up in a little bit of the negativity, but we have to look back and say we really came a long way since the beginning of the pandemic. We don't lose patients anymore to COVID. We have better infection control policies, and we really have. We've come a long way. So we try to, you know, look back and learn from that, so that we can grow forward. It really is a collaboration of effort.
Well, I know I speak on
entire
everyone
team
here that
at
we
large.
appreciate that strength that you guys continue to
you.
show every day.
We're all rowing.
Yep,
We're in the
yep,
boat.
yep.
We're rowing.
All right, thank you. I think that now we go into the, yes. We're just going to take a very, very short break, maybe a 3 to 5 minute break, just so that we can set up the screens for the presentation
Okay.
for the 2022 financial report by O'Connor Davies, and with Chris McCarthy, Michelle O'Reilly, and with Donna Streckler, okay?
Mr. Chairman, before we go in, I've had my hand up. When I say no department didn't come to Highland Falls, Donna and Lawrence came through for me. I had one of my evacuees who needed a hospital bed. And I called, we were working through DSS, and then I called Lawrence, and he called Donna, and they were able to get one of the beds from the closed ward, and our DPW brought it down for the evacuee in the shelter. So literally, no department has not stepped up
Yeah.
for the town of Highlands. So thank you.
You're very
Thank you.
welcome.
Thank you, Lori, and thank you, Donna. Okay, do I need a motion to just take a short break? Doreen? No, no? Okay, we'll see you back here at 10 to 5. Excuse me? Snacks? I don't have it. Joe, you looking good there? I'm back again. Joe, we're good? Okay. All right, everyone, we're going to start back up again. Right where we left off, the Valley View Center for Nursing Care and Rehabilitation, report to the county executive, Stephen Newhouse, and honorable legislature of the County of Orange, New York, completed December 31st, 2022. And from PKF O'Connor Davies, accountants and advisors, we have Chris McCarthy and Michelle O'Reilly. And from Valley View, we have Donna Strecker. So if you guys want to start leading us through, that would be great.
Thank you. Good afternoon, everybody. I'm Michelle O'Reilly, partner with PKF O'Connor Davies. I'm the engagement.
Maybe pull it closer to your.
Okay. So, good afternoon. I'm Michelle O'Reilly, partner with PKF O'Connor Davies. I'm the engagement partner for the audit, so I'm responsible for the team's boots on the ground. But I also work in conjunction with the county's audit team, working with them, and then also with my partner, Chris.
Hi, Chris McCarthy. I'm the co-lead of the healthcare practice at PKF O'Connor Davies, and I promise this will not be another one of those long presentations, I promise. And I assist Michelle during the course of the audit. My specialty is understanding how a skilled nursing facility is paid by both Medicaid and Medicare, so I'm assisting Michelle during the course of the audit. You want to advance the screen? So just looking at the engagement status and just a minute on why an audit. If you think about it, Valley View is one column of your consolidated or your county-wide financial statements. It's already undergone an audit as part of the overall audit of the county. The need for a very specific audit for Valley View is not driven by the county itself or state requirements. It's really driven by the Medicaid requirement that all nursing homes in the state of New York, there are about 600, file an annual Medicaid cost report. It's a financial statement, basically, and that must be audited by an independent accounting firm. So it's kind of duplicate, I don't want to say it's duplicating some of the work, but in a sense it kind of is, unfortunately, because the Valley View is already part of, again, the overall audit, which our firm handles, PCAF O'Connor Davies handles, and I believe they just met yesterday to discuss the financial statements of the county-wide financial statements. And you are one sliver, one column in the enterprise fund of the county financial statements. So really what happens is we conduct an audit of that column because it goes on to a Medicaid cost report, which is due to the state of New York, the Medicaid program, August 9th, this particular year. It's important to keep that in mind because some of the audit work is actually conducted by the county auditors, the PKF team handling the county audit. That's primarily some of the items like the OPEB, pension, and some of those large issues. We spend quite a bit of our time looking at items that are really driven by the nursing home itself, primarily billing, census, revenue, and selected expenses. So it kind of makes sense as we go through the process. As far as engagement status, the audit itself is completed. The work performed was done in accordance with our audit plan, so there's no significant change or no change in the audit plan. We issued an unmodified or clean opinion on the financial statements. The cost reports, your Medicare cost report, which is due May 31st, it's already been filed. As I mentioned, the Medicaid, the RHCF4 Medicaid cost report is due August 9th this year. That's already been completed. It's in the review stage of the process, and then that will be filed along with our audit opinion on that particular cost report. Also, since Valley View, along with the county itself, receive federal funds or certain amounts, in this particular case, Valley View received provider relief funds. That's subject to a uniform grant guidance audit. That's due by September 30th, and that is being handled by a combination of the team that handled the nursing home audit along with the team that's handling the county audit.
Okay, for the next part of our presentation, I'm going to talk about our responsibilities as auditors. I'm not going to cover every point on the slide, but certainly if somebody has a question, please let me know. So we are responsible to form and express an opinion in accordance with our professional standards. And we obtain reasonable assurance that the financial statements are reasonably free of errors. We do not perform 100% testing, so we look at certain areas, and some of those Chris mentioned, and we'll see more of those areas further on in our presentation. We do have to look at your internal controls. That helps us with our audit procedures. We have to conduct our audit with professional skepticism, so that's the trust but verify principle. That means that we have to see audit evidence to support the numbers. The financial statements have supplemental schedules, and our opinion does extend to those supplemental schedules. We're required to communicate with you, those charged with governance, that's an acronym that you see here, TCWG, regarding risks that we identified during the audit, and we'll talk about those later on another slide. If we found any significant deficiencies or material weaknesses, we would have to tell you about those. We did not, I'm happy to report, we did not identify any control deficiencies, but there is an exhibit further along in the presentation that talks about what those control deficiencies could be. But again, we did not identify any. If we noted any fraud or illegal acts, we'd have to tell you about that as well, and we noted none. And then estimates, if there was some discrepancies regarding estimates, we would have to talk to you about that as well, and there were none. Management and those charged with governance also has responsibilities in overseeing the financial reporting process, and that is to select appropriate accounting policies, fairly present the financial statements, establish and maintain effective internal controls, comply with laws, regulations, grants, and contracts, and providing us the information that we need to complete our audit. Certainly setting the proper tone at the top, and designing and implementing policies and controls to prevent and detect fraud. And so those charged with governance does have the responsibility to communicate with us in overseeing the financial reporting process, and that's what we're doing here today. So those were our responsibilities. So we have next for you on slide 7, our audit scope and approach. And so we've listed here for you some of the significant audit areas that we work on during our audit. So there's a lot of time spent on residents' accounts receivable, amounts due to third-party payers, and we have some slides here prepared for you regarding that Chris will go through certainly in a few slides. We also take a look at the intergovernmental transfer. I think everybody's aware that it was held up by the state this year and not approved, and there were significant conversations regarding that with our county audit team. And, we waited till the last possible minute to finish to see if that approval came through, and unfortunately it did not. So we'll see the impact of that on the financial statements. Other areas we look at are capital assets, accounts payable, accrued vacation, payroll, and some other expenses. And then these last 5 bullets here on the slide, due from other funds, long-term debt, net pension liability, your OPEB, and the new lease guidance that had to be implemented. These we work on in conjunction with the county audit team. So as Chris explained, the county goes in and audits the county, and then the piece that's for Valley View is carved out, and we take that for our financial statements. We make sure it agrees to the general ledger, it's recorded properly. So it is a collaborative effort. And then the guidance regarding leases was new this year, so that was a heavy lift for everybody, the finance teams, including the auditors, because it was new. Everybody had to learn it. So you may recall we normally present these financial statements to you in June, but due to the implementation of the new lease guidance and the county needing to accumulate that information and identify Valley View's pieces and waiting for the IGT approval, which unfortunately didn't come, we needed to finish up a little bit later this year, and so our meeting was delayed to July. When we perform our audit, we have to look at subsequent events, so that's things that happen after your year end, through the time we release the financial statements. We look at commitments and contingencies, any related party transactions, and if there are fraud or illegal acts, and again, we did not identify any. And this just says other areas, again, talking about procedures under government auditing standards. So that's the GASB-related adjustments, the OPEB, the pension. Those are worked on in conjunction with the county audit team.
I assure you, we're not going to go through every slide. There are a number of slides in the back that are listed as appendix. It's just additional information. We'll spend just a few minutes just looking at resident accounts receivable and resident revenue. What this particular slide shows, and we've dropped 3 zeros, so it's not, for example, accounts receivable $3,000. That's $3 million. Net patient service revenue, $34 million. These are 2 key areas from an audit standpoint. First, with accounts receivable, a general audit, we would send a confirmation to whoever owes an organization money. But most of the amounts that are due to Valley View, like any skilled nursing facility, they're due from Medicare, Medicaid, and insurance companies. Those payers do not respond to a confirmation, so we have to perform alternative procedures. So we spend quite a bit of time looking at accounts receivable. I think the 2 key takeaways when you look at this particular schedule, number one, your accounts receivable is down, which means, number one, that you're collecting. And if you look at days in accounts receivable, you're collecting the unpaid balances faster. The statewide average for a skilled nursing facility generally runs about 50 to 55 days. So you're doing a bang-up job within Valley View as far as billing and collecting. So it's great to see that. Net patient service revenue is down when you compare it to the previous year. It's down about 3.6 million. And virtually all of that is due to the census being down. That was a good 3 million something hit to the bottom line just by not having those beds filled. In fact, if you move to the next slide, and just so you understand the impact and the importance of this and what the organization is going through. You may want to write this down in a book. I don't have it shown here, but if you look at the four payers listed on the left-hand side, Medicaid, Medicare, private, and commercial. Private and commercial, Valley View probably averages about $420 a day for those services from those payers. If you look at Medicare, Valley View gets about $700 per day from Medicare. So about $420 to $450 from commercial and private, about $700 from Medicare. The largest payer, though, about 82% of your patient days were Medicaid. Medicaid pays Valley View $290. Just think of the disparity. The largest payer class, Medicaid, it's not unusual, that's across the entire country. But the Medicaid amount is about $290 a day, significantly less than Medicare and the other payers. Yes?
Did they, there was some talk they were going to do like 5%, they should be giving us 20.
Great point, yes. For the first time, they are past a inflation factor to the rates. Right now, Valley View and the other 600 nursing homes, the prices you're paid for rendering services for a number of the components, probably about 80% of your rate, is based on 2007 dollars. It's 2023. It's based on 2007. So finally, they proposed and it was passed, pending approval from CMS, anywhere from 6.5% to 7.5% increase to the operating component. And that's significant. That truly is significant. So.
Nowhere where we should be, I don't think.
No way, yeah, exactly.
But that's another discussion. Sorry.
Absolutely, no. But I mean, you know, that comes into play when you start to look at, it sounds easy, oh, just hire more people. But if you can find those employees, which is the biggest problem that we're seeing across the state, and actually across the country, you could then fill those beds. And once you start to fill those beds with higher Medicaid rates, then you're going to start to see some changes, so. I won't bore you with the next slide. It's just, you know, how we actually ordered it. What I would like to do, if you slide to go to the next slide. Now, you're going to see a slight difference, and you got to forgive me. The handout you have, I had entered one number incorrectly. But what I want to show here is this is the actual census. And no matter where we look, whether it's New York State or within the country itself, everyone experienced the same thing. You'll see prior to COVID, Valley View, generally, for the most part, that's in orange. The blue is the rest of Orange County. There are 10 nursing homes in Orange County, including Valley View. You generally ran about 93.5% occupancy historically. Fantastic. The county itself, 93.5, then started to dip a little. But you see after 2019, you see this big drop during 2020, obviously because of COVID. Significant decrease in admissions, and discharges certainly were increasing. And here's the issue, the real issue that you're starting to see, and I can tell you that only about 50% of the facilities nationwide are back to pre-COVID occupancy. So the other 50% still has not recovered. But when you look at this, here's the real issue. You see that Valley View continued to drop through 2022, and you're like, and I know Donna just indicated you're in a 60-something% range. And that's really the biggest difficult issue that you're facing right now is how do you get that census back up? But doing it in such a way that you're not going to be penalized. Donna had mentioned before this new regulation on minimum staffing requirements. The penalty can be up to $2,000 per day if you don't meet the minimum staffing requirements. So it's one of those issues where you want to fill the beds, but you have to make sure that you're adequately staffed. Otherwise, you're going to be bombarded with penalties. So the next two slides, a lot of data. Sure, I'm sorry. Yes.
Thank you, Chris. For this whole package, when I looked at it, everything made sense except this one slide. So I'm glad you said that there was one error, but it still leaves me a little confused. For definition purposes, when you say snapshot,
Yes.
what did you do with the 10 homes?
Oh,
Did you take
great.
an-
I'm so glad you brought that up.
10 homes, did you average them? Did you take a sampling of some of them and not others?
No, great. Since 2008, skilled nursing facilities in the state of New York, and many states do this, but since 2008, skilled nursing facilities in the state of New York must report 1 day a week your actual occupancy. So that information is available. So the snapshot is on a particular day, the state facilities, all facilities are reporting their census. They could be off a day or two. You know, maybe everyone says, oh, January 3rd is the next reporting. You may get it in January 5th. But that allows the state of New York to see how census is throughout the state itself. So I have 52 snapshots of all the nursing homes in the state of New York. So I can take the county, Orange County, take those 10 facilities. But I actually have Valley View's actual by month. So the Valley View number is much more accurate. The others are, it's a snapshot. 1 day a week, what does the occupancy look like?
Did we, when you did that snapshot, so you did a snapshot 1 day a week, 52 weeks for the 10 other nursing homes?
Yep.
Versus actuals for Valley View. But
Yes.
did you compare on the snapshot date or close to it, Valley View versus the others? And was the differential the same as it is here?
Basically, it is.
is.
Great question. So when you lay on this, if you were to lay on top of this, the Valley View's 52 snapshots,
Yeah.
it looks about the same.
Okay, so then my big problem I have with all this is not how it's reported. It's not the fact that, you know, nothing was done wrong. My question is, why? Why do we have the lower, when we were, in theory, the better nursing home in Orange County in terms of performance by its workers and people wanted to come here? Why is our census roughly, 14, 15% lower than the average of every other nursing home in Orange County? Do we have an answer to that?
I do look at these analytics that come from the state. You know, being a public nursing home, number one, there are other opportunities available in a private nursing home as far as how they want to compensate their employees for overtime or incent them to come in. Also geographically, where Valley View is located, there is a nursing home that's more centrally located in Middletown, where it's easy access, don't require public transportation to get there. Those are some of the obstacles we face. The other thing is that Valley View is one of the largest nursing homes.
The largest in Orange County.
Yes, we are the largest nursing home in Orange County. We took action to close units. Every time we had an outbreak in the facility, we had to close units. So we took action and the appropriate actions, and all of these things have affected our census. I can't speak to the operations of other facilities, but I will tell you that when I look at hours per patient that is out in this public site, Valley's hours per patient are higher than some of our competitors. And that's an important thing when it comes to quality of care.
Okay, so I think I understand this. So in theory, we're saying some of these other, or all of these other nursing homes maybe did not, I don't know what the right term is, lose as many staff as we did, thus they did not close down any units, and they are providing service to their residents, less service to their residents because of the proportion of people they have than what we are. We chose to close units down when we didn't have enough people and provide more service to people, and the trade-off is we lose census on that. Is that an encapsulation that makes sense?
Well, we're not going to take in patients that we can't care for. And sometimes other facilities may or may not make different choices. I can't speak to their operations. I only know that the analytics show that Valley's View hours per patient is higher.
Understood. Thank you, Donna.
You're welcome.
Let me go back to the chart, one or two quick questions. What was the variance on the 10 snapshots? Were there a lot of them clustered around the 82%, or were there higher and lower? And when they were lower, were they approaching the percentages that Valley View had?
You did have there was at least, I recall, at least one that was down in the Valley View range as well. But they, for the most part, they were relatively close, so it wasn't a large variation. So it was relatively close.
Does that, if they were relatively close and there was not a large variation, does that data tell you anything that could help us here with the Valley View situation?
I think in addition to trying to find the employees and staffing adequately, which is, I know, a driving force behind Valley View to make sure that you have the staff. You may want to take some time, meet with the discharge planners at the hospitals to find out if there are 10 facilities, why do the other 9 appear to have more patients? Is there a reason that they may be going to other facilities?
Okay.
And, and that sometimes can be an eye opener, and sometimes it's just, oh, we never thought that, to send them your way.
Right, right.
Yeah.
Because as I say, when I went through all the material, it all makes sense. I expected everything, except I didn't expect this page. This page didn't make sense to me because I thought everyone would be roughly in the same ballpark as we were, as roughly I thought everyone was across the United States of America, and this was kind of an eye-opener to me.
Yeah, it's once the organization started to kind of, everyone bottomed out because of COVID, that's we've seen a gradual increase. And at the moment, Valley View is not experiencing that increase.
Okay, thank you. Thank you.
Donna, just one follow-up on that question. If Valley View is county residents only, correct? No? Okay. I thought that we had to have some connection there.
We have a large percentage of our residents are Orange County residents, but we do have other residents from other counties, Sullivan, Westchester.
Okay,
Okay.
thank you for clarifying.
The next slide, next couple of slides, it's a lot going on. I just want to point out some key things, and this is something that Valley View is very good at. If you look at the far right at the top, you'll see 3 numbers. And then we'll move on. 1.09 is the Valley View average case mix for the past 3 years. And here's the interesting thing. If you look down below, and this is all nursing homes combined. If you look down below, the for-profit nursing homes, the average case mix is a 1.29. And other county-operated and not-for-profit nursing homes is a 1.05. So Valley View has a case mix better than, about 4 points better than the other county and not-for-profit nursing homes. Case mix is what drives your Medicaid rate. The higher the case mix, in theory, the more care that needs to be rendered to the patients. And Medicaid will pay you more if your case mix is high or goes up. If your case mix goes down, you get paid less. The case mix is actually determined by the actual facility itself. So you, Valley View, like the other 600 nursing homes, you score your own patients twice a year. So that case mix is a driving number to, that's the only other way that your rate would ever change, because there's no inflation factor, as you'd raised before. The only way you could increase your rate generally was case mix. So when you look at this, and it's just you could see that you're doing better across the state. And if you were to flip to the next slide, this is looking at Valley View compared to the other 9 facilities in Orange County. There's still, your 1.09, and now you'll see proprietary or for-profit nursing homes, the case mix is 1.31, and the other not-for-profit facilities within Orange County, it's about a 1.01. So you're about 8 points higher. A point for Valley View is about $1.66 for every single Medicaid patient. So on an annual basis, if you have 80,000 days, that's about $130,000 of additional reimbursement. So it's a quick and dirty way from a management standpoint to know, once you know your case mix, every time it changes, if it goes up 5 points, you can say, okay, that's 5 times $133,000, whatever it comes out to. Will it cost me that much more in care? Generally, it won't. And I think one of the key areas that Valley View is stressing is looking for those rehab patients, patients that require rehab, physical therapy, occupational therapy. Those patients have high case mix scores, and those are short-term patients. And they're not generally, I don't want to sound, crass, they're not expensive patients, because what they're really getting besides some basic nursing is they're getting the therapy. And it's an efficient way. So when you look at the proprietary nursing homes, they generally are caring for those types of patients. That's what they're looking for. So it would make sense if you could, as you open up the next unit, again, looking for those higher scoring patients, case mix will go up. So you've got the inflation factor increasing the Medicaid rate. You would have a case mix increasing the Medicaid rate. In addition, you'd have more patient days because your census would be going up. So kind of, a three-prong approach. Next page is just a quick, some of the other items that we spent some time looking at is, we often joke, you wouldn't have amounts due to or due from third-party payers if the third-party pay would calculate their rates on a timely basis, and they don't always do that. So what I'm showing here is, and this is disclosed, but not in this level of detail, the actual amounts that are due to third-party payers. For a 360-bed facility, this is not a large number. You have some amounts due based on estimated case mix. You have a liability for the Office of the Medicaid Inspector General. They conduct audits. They did a 5-year audit that indicated Valley View was overpaid about $365,000. And it really was due to one particular item. Otherwise, this is really, when you consider that what is $25 million a year for Medicaid, it's about $70,000 being paid back per year. That's nothing. So I want to commend Donna and her staff on being on top of that. But the other amounts, it's some of these deferred portions that represents cash you received in 2022 that covers the first quarter of 2023. So those items have been deferred. So that's the $119,000, the $81,000. So again, that's what is, when you look at the financial statements of Valley View, and that's one of the unique things that's not necessarily looked at from the countywide financial statements, and those are many of the items that we are looking at when we audit just that column called Valley View, the enterprise fund, to make sure it's reported on the cost report correctly. Next page.
Okay, so at this point, we wanted to just switch over quickly to the statement of revenue and expenses and actual financial statements to show you the operations and some of the changes. Now, you'll note that your total change, your total loss was about 11.7 million compared to 18 million last year. You can see here that you received from some provider relief funds of about $3.2 million that assisted you to reduce the loss from operations of the $16 million. And also you can see that the IGA, the intergovernmental transfer was only about 2.1 compared to 7.9 last year because you only received about 3 months worth. So looking up above, you can see overall your revenue was only down about $3.2 million. So it was just about $35 million for 2022, 38 for 2021. Your operating expenses did go down about $12 million. So $50 million for 22 compared to 62 in 21. So a lot of this is a combination of, you had the decrease in census, you had changes in your rates, but a lot of it is also with the employee benefits that have to get paid. So overall, the change in net position, overall loss about 11.7, shouldn't be that different from what you've been seeing all year and has been reported to you, because the only differences here were the impact of the GASB adjustments that we worked on with the county audit team. So that net effect overall wasn't that much. We have I'm going to go back to the next slide to show you that. And this just shows that overall the operations were consistent with what was reported to you. So I'm trying to drive and. So here's where you can see that the overall impact of those GASB adjustments that we wait for 2022, the net effect is really only about $2 million. So again, operations that were reported to you, not that much different than what is being shown in the audited financial statements.
And if I could just add to that, so as we look at this, and it's an easiest snapshot looking at it this way. There's the $11 million dollars in 2022 versus the $18 million in 2021. We know that those GASB adjustments to pension, and in particular the OPEB, it's a significant adjustment, and it's a significant adjustment to only about 20 nursing homes in the state of New York, because there are only about 20 county-operated or facilities such as like Health and Hospitals Corporation that records this. The key really is, as Michelle said, when you look at 2022, if you were a nursing home that didn't have to record this, but obviously you do, and we've discussed this for the past 5 years now, the OPEB in particular, if that wasn't recorded, it's worth about $5 million being added back to the bottom line. If you didn't have to record that, I know it sounds like, this is make-believe. Let's make believe we don't have to do this. You do have to. But that key really is when you look at the $9 million after you adjust for these things, we can kind of explain from an audit standpoint. We said, does that make sense? Because always trying to look at, does it make sense when we look compared to last year? And last year with these adjustments, it's $6 million. Well, what are the differences? Well, in 2022, as Michelle said, you only got 1/4 of IGT. Anyone that should have received IGT only received the first quarter of 2022. It still has not been approved by CMS at the federal level. So you're missing about $6 million that would have been recorded as IGT revenue. What you do have, though, that you didn't have last year was provider relief funds of $3 million. So you've got 6 one way, 3 the other. So that $9 million, when you adjust for that, is really $6 million, which kind of matches 2021. And I know it's a lot of numbers. We've been living with it, so it makes sense from an audit standpoint. But it was just another way of trying to look at a financial statement of a county-operated facility that has these additional adjustments, especially the OPEB. It's significant. It truly is.
Thank you, Mr. Chairman. Chris, thank you. That's probably the most difficult thing, I think, is to try to explain the OPEB to people that are not accountants and don't understand the accounting principles. But I think that page makes a lot of sense if you take it there and just simplistically, if you're negative 9.481, you've got built in there, and correct me if I'm wrong at anything that I say, you've got built in there the OPEB, which is a book entry, has to be put in there for accounting purposes for this kind of a nursing home, but is not an operating expense that is incurred by the nursing home, yet it is in there showing minus $9 million for the facility. But if we just said, okay, let's back that out because it's just a book entry, it's not an actual operating expense, the facility then would be in the deficit in the order of $4 million, right? 9.4, subtract out the 5.579, which is a lot better than I expected the facility to be doing under these circumstances. And then when you think, now I know there's no such thing, and I know that you don't do this accounting-wise, but if there was an IGT receivables line that you could put in that you're owed 4.8 million of receivables of IGT that we didn't get this year, but we'll get it next year. So next year will look even better, even though this year doesn't look as good. But if there was a receivables line for that 4.8 million, my God, we'd be breaking even under these circumstances, which to me is amazing. So anyway, that's my 2 cents. Did I say anything wrong?
No, again, I agree with you especially as far as the OPEB. It's a transaction that has to be recorded. It's not a cash outlay. It's looking at the future, the liability that you're incurring now because you offer health insurance to retirees. So you've got to recognize that liability now. So it's unfortunate because I always say, and it's based on actuarial assumptions, and it's at a point in time, December 31st or January 1st. So it's unfortunate because it really skews the financial statement of an entity like this.
I know that the methodology for the OPEB was changed like 2 or 3 years ago, dramatically changed. But the other thing that kind of surprised me here was that it went down from the 13.7 million to the 5.5, and I have no idea why that would have occurred.
It's a great point because what happened is the discount rate doubled. And as it's an inverse relationship, as the interest expense or the discount rate in the actuary's calculation
Oh, so the higher
increases.
interest rates actually made that go, that's
Right.
interesting.
Yes,
Okay, interesting.
so
but
it's
that-
probably the only positive when interest rates are going up, is
Sure.
that you know that the OPEB is going down.
Unbelievable.
So,
You learn something every day.
so I think we're going to kind of wrap it up now. We're going to go very quickly through some of the required communications, and then I promise we are done.
So. Okay, so again, just very quickly, some information we should tell you when we all get together. Your significant accounting policies are in note 2 to the financial statements. Now, there was a new accounting policy that was required to be adopted this year with regards to leases, the implementation of the lease guidance. So when you look at the notes, you'll see the policy and some additional information for leases. If we noticed anything unusual during our audit, we would have to tell you. That's what it says there at the bottom. Estimates are inherent in financial statements. So we spend a lot of time auditing those estimates. Again, allowance for doubtful accounts related to accounts receivable and amounts due to and from third-party payers, which, Chris had spent a lot of time on. Certainly depreciation expense, your OPEB, and the net pension liability are the biggest estimates in your financial statements. The disclosures in your financial statements, sometimes they can be sensitive, so we just kind of identified a few that we think would be more interesting to a reader and wanted to highlight for you. So again, note 6 talks about the long-term liabilities of the facility. Notes 9 and 10, again, the retirement, the OPEB, lots of note disclosures required for those. And then note 12, certainly commitments and contingencies, which are normal with most skilled nursing facilities. If we had any difficulties, we would have to tell you about that. I'm happy to report we did not. Certainly, Donna and the finance team gave us every courtesy for all the information we requested, so we thank you and your team. With regards to going concern, if we thought for some reason you wouldn't continue to be a viable fiscal entity beyond 1 year from the auditor's report, we'd have to tell you about that. But again, you are part of the overall county, so we'd had no concerns there. Now, I just want to make sure I point out when you see this box, significant risks, these are areas that when we plan and perform our audit, we spend a lot of time on because it's areas that could be subject to risk. It does not mean we found anything. So certainly, management override controls, we do audit procedures to address that. We found nothing. We make sure that the notes to the financial statements are clear and transparent. And then in proper revenue recognition, the auditing standards say that's always a fraud risk. So again, the majority of our procedures are around revenue recognition. We had no disagreements with regards to accounting or auditing matters. As part of an audit, we're required to get a signed management representation letter that basically says everything that management gave us is true and accurate, and we did receive that for the financial statements. And then the last thing we'll leave you with here is just that we are independent. We have to be independent to perform your financial statement audit, and we are nothing arose that would impair our independence. Beyond here, it just talks about, the first box is required about if you were opinion shopping, we'd have to tell you about it, but certainly that didn't happen. At the bottom, what I want to point out with regards to corrected or uncorrected misstatements, that means adjusting journal entries. We had no material adjustments. We worked on management with a few areas that were talked about throughout the course of the audit. But the biggest adjustments were the post-closing entries were related to the GASB items. So again, the management team did a nice job with the books and records. Beyond here, this is really just a takeaway. We talked about it earlier, internal controls. We did not identify any control issues, so there's just some language here for you as a takeaway for definitions. But the big key takeaway is that we did not identify any material weaknesses or other issues that we would have to address with you today. And again, I think this is just a takeaway we had for you for some additional information that we thought you might find interesting when you can't sleep tonight. You could take a look at that. And then there's our firm information. So that was our presentation that we prepared for you. Any other questions that we can answer?
Thank you again, Mr. Chairman. Thank you again. I thought the presentation was outstanding, but for informational purposes for the committee and to put on record, I think it's very material to talk about. If you look on page 4 of the actual audit report, we can see that at year-end, December 31st of 2022, Valley View had $42.872 million of cash on reserve versus the $48.425 million it had the year before. And again, considering there's a theoretical receivable of $4.8 million of IGT, that would put us almost on par with last year's closing balance for the facility. Again, pretty remarkable when you consider the deficit has been funded through cash balances for the last few years during COVID. So all of that, I think, is very material to the story, especially since there was a legislator that tried for years and years and years to uncover that huge balance that was there that everyone kept saying was never there. So I think it should never be forgotten that Valley View does have $42.872 million as of the close, December 31st, 2022. Thank you.
So great point. Thank you.
Okay, any other questions, comments? If not, I just want to thank you both, Michelle and Chris and Donna, for a great job and trying to lay this out in a manner that we can all kind of grasp. So without any other ado, if I could get a motion to adjourn. Second, okay. Lujan and Tortel, all in favor? Aye. Motion adjourned, approved. And thank you, everyone. Thank you, Joe Joy.